Hello, everyone. We are going to get started. It's great to have everyone here for the webinar today. We are going to discuss our findings from our recently released study, Insult to Injury, Natural Disasters, and Residents' Financial Health. Before we get started, a few housekeeping items. This webinar will be recorded. The recording will be posted online after the webinar. We'll also send out an email, likely early next week, with the link as well as the slides from today's presentation. All participants are muted, but at any time you can ask a question. Just type your question or comment into the question box, and it would be great if you could include your name and organization. If you'd like to tweet, our hashtag is #LiveAtUrban. All right. So just some introductions. So I am Caroline Ratcliffe. I'm a senior fellow here at the Urban Institute. I also co-direct Urban's Opportunity and Ownership Initiative, where we focus on wealth and financial health over the life course. So we're looking at what are threats to financial health and security and ways to improve family financial security, both thinking about short-term and long-term. We are very lucky to have with us here a great lineup. Ann Romatowski is a vice president at JPMorgan Chase. Ann works on JPMorgan Chase's global financial capability strategies. She manages the foundation's global financial health grant making, as well as their Financial Solutions Lab, and previously worked at New York City's Office of Financial Empowerment. And we thank JPMorgan Chase for their support for this research. And we have Carlos Martin, who's also a senior fellow here at the Urban Institute. Much of Carlos's work focuses on housing and climate adaptation and disaster mitigation. He's currently leading research on housing strategies for climate adaptation for the National Academy's Gulf Research Program, and he's also leading the multi-year evaluation of the Rockefeller Foundation's 100 Resilient Cities. And we have also with us Zelalem Adelfri, who is the Resilience Director at Catalyst Miami. At Catalyst Miami, Zelalem works to educate Miami-Dade County's residents on climate threats, to build climate leadership in Miami-Dade County's low and middle income communities, and implement programs that strengthen communities and resilience. So before we get over and turn over to the results, I want to turn this over to Ann to provide some welcome remarks and talk about JPMC's interest in this work.
Thanks so much, Caroline, and thank you for everybody who's joining today. We're really excited about this research and really have been delighted to partner with the Urban Institute over the past several years to look at the financial health of people across the United States, but particularly on populations and communities that are underserved and face particular barriers. And, you know, we think that there's really important and useful findings for a variety of audiences coming out of this research that you'll hear more about today. We've also been really proud and honored to partner with Catalyst Miami on a number of different initiatives over the past several years, so we're excited that you'll be able to hear from them today as well. At JPMorgan Chase, we have a firm-wide approach to financial health, which is one of 4 pillars of focus that we really engage around and orient our corporate responsibility towards. So in addition to financial health, we also focus on helping small businesses to develop and grow. We also focus on workforce readiness, helping to build jobs and skills for workers across the world. And then finally, neighborhood revitalization is a key pillar of ours, focusing on community development. We focus on these 4 areas so that we can bring not just our philanthropic commitment to communities where we operate, but also so that we can bring really the full force of our firm, in addition to our philanthropy, that from a financial perspective, that means our research, our data, and the expertise of our workforce. So on that note, I want to highlight a little bit of work that the J.P. Morgan Chase Institute has done related to the topic that you're going to hear about today on natural disasters and the sort of financial implications that they have in communities. In February 2018, the J.P. Morgan Chase Institute released a research brief focused on the daily financial experiences and decisions of consumers and small businesses in Houston and Miami following Hurricanes Harvey and Irma, respectively. So to conduct this research, the Institute leveraged de-identified data from nearly 1 million consumer checking accounts to provide a daily lens into the impact of these natural disasters on financial flows. And what they found was that these disasters really were the source of a major financial disruption for families, and that families disrupted their healthcare spending and their debt payment patterns, during and after the storms, including more than 2 months after the storms. So, that research was done on sort of a relatively short time frame following those disasters, and so we're really excited that the Urban Institute has this research that's looking even longer term at a broader depth of disasters, and I think has sort of really important contribution to the knowledge base that we all have. And I think, I personally really found the recommendations that the team at Urban has come up with to be very helpful for the perspective not just of philanthropy, but of program design, local practitioners, as well as policymakers. So with that, I want to thank again the Urban Institute and Catalyst Miami, and hand it back over.
Great, thank you very much, Anne. All right, so with that, we will get into the study and the findings and recommendations. So first, I want to start out with what are avenues through which natural disasters can affect financial health. So first, there's the preparation. So this is a picture of evacuation from a Gulf Coast storm. So we can just think about the gas to get out of town. You need a car to do that, where the person's going to stay when they get out of town. So there's cost with the preparation for the disaster. And then what we often think about is personal property being damaged or destroyed. And when this happens, say a flooded home can leave a homeowner with both a mortgage and rent payment until the home is habitable. A damaged car can leave a homeowner with a loan to pay but no way to get to work. So there's the damage of property. Also, this picture here shows a flooded downtown area. So businesses can be flooded or shut down for days, if not weeks. And so if employees the workers don't have benefits, then they can go without a paycheck. And then there could be bodily injury, stress from the disaster, which could lead to additional health care costs, mental health services. So the questions that we had, so all of these items that I just talked about, they can all lead to effects on financial health. So our questions are, what are the effects of natural disasters on financial health? Second, how do these effects differ by severity of the disaster, where the severity can result in different amounts of recovery assistance? So when we started this work, we hypothesized that smaller scale disasters can lead to larger declines in financial health because of the more limited resources available to people and communities hit by these smaller scale disasters. So we wanted to look at disaster size. And then the third question here is, how do the effects differ by demographic and economic characteristics of residents and the communities that they live in? Are we seeing bigger declines for more disadvantaged residents and communities, and as a result of this, that these disasters are leading to increases in inequality. So just quickly on some measures and approach before we get to the results. So financial health, how are we measuring that? Well, we have access here at the Urban Institute to major credit bureau, data from a major credit bureau from 2010 to 2017. We have data on roughly 5 million U.S. consumers, and we can see a number of measures over time that get at their credit health through this credit bureau data. So credit score, debt and collections, bankruptcy, credit card access, and then measures of mortgage delinquency and foreclosure. So, for example, debt and collections and bankruptcy, here we're getting at measures of financial distress. Then we need to identify where these disasters are happening in affected communities. There we use data from FEMA, and we look at 3 different groups. So we look at Hurricane Sandy, and we separate out Hurricane Sandy because it is by far the largest disaster in our study. Next, we look at this group that we call large disasters, and this includes those disasters where FEMA assessed $200 million or more in damage under the individual and housing program. And then medium-sized disasters are disasters with less than $200 million in assessed damage under the FEMA program, but they were also large enough to trigger FEMA assistance. So that's why we're calling them medium and not small. I want to mention here that our group of medium-sized disasters, most of the people were hit by the 2014 storms and flooding in and around Detroit area. So that's a lot of the people in this medium-sized disaster group are from there. And then we have community characteristics that we get from the American Community Survey. Our approach, just quickly, so first what we're doing is we identify communities affected by the natural disaster. And here, when we're saying communities affected, we are identifying those communities where at least 20% of residents applied for FEMA assistance. So we have a threshold there. We don't want just 2 people in the area to have been affected. So we have this 20% threshold. Then what we do is we identify similar communities that are unaffected by the natural disaster. So we use a matching model to get that. Then we compare people in affected communities to people with similar characteristics in these similar unaffected areas, again, using a matching model. And then we look out over time. So in the results I'm going to talk about, we look at 1 year, 2, 3, and 4 years after the disaster. Because here everything is done at the zip code level, so we can't identify which residents are affected or directly suffer as a result of the natural disaster. So we're looking at all individuals in the affected area. So some of these people are going to have large, really highly impacted, and some people might not be impacted at all. So this is on average what we're seeing. Okay, now to the good stuff, the findings. So credit score, I want to say a few words about that before I show the results. So we can think about credit score as an overall measure of financial health. It determines access to credit and the price of credit. So this slide is showing that having a subprime credit score is costly. So having bad credit increases both the cost of borrowing, and this can cost residents hundreds, if not thousands of dollars. So if I'm just going to talk about the first 2 bars up there. This is if an individual takes out a $10,000 car loan and they pay it back over 4 years. For somebody with subprime credit, they can pay $4,000 for that loan. in interest. For someone with prime credit, it's $1,000. So here we're talking about $3,000 that this individual could use to save or meet their household needs. So if a natural disaster reduces credit score, that reduction is not only a general indicator of reduced financial health, but it can also be a central mechanism by which natural disasters lead to other harmful financial health outcomes. And we think this is what's happening, and we'll talk about that through the results. Okay, so now the good things, or really sort of not good in terms of people's well-being, but in terms of the findings. So what we find here, and this slide shows, is that living in an area affected by a natural disaster leads to significant and persistent reductions in credit scores. And again, this is compared with living in an unaffected area with otherwise similar residents. So we see that there is a decline in credit score in the first year after the disaster strikes, and it tends to increase over time. So first, looking at Hurricane Sandy, there is an initial 7-point decline in credit score, but when we look 4 years out, we see that there's a 10-point decline in credit score. We see that both in the third year and then in the fourth year. We find more substantial declines in credit scores for people hit by medium-sized disasters. This is the black line. So here, there's an initial 9-point decline, and it reaches 22-point decline after 4 years. So what does this mean? Well, in our data, the average credit score in year 4 is just under 650 points, the credit score. So this is near the borderline of what is considered a fair or poor credit score. So a 22-point decline can make them solidly a poor credit risk. It can restrict access to traditional credit, and that can translate into higher costs, particularly if people are pushed out of the traditional credit market and they're pushed into alternatives like payday loans and auto title loans. I do want to remind you here that for the medium-sized disasters, most of the people were affected by that 2014 storm that hit urban areas in and around Detroit. Finally, there's this light gray line at the top. That's these other large disasters. There we have negative effects on credit scores. They're small, they're not statistically significant. We have much smaller samples for this group of large disasters. We see these smaller effects consistently for this group of large disasters. We present lots of numbers in the tables in the paper, but I'm not going to talk about them further in this presentation. So this is overall for all the residents, but we also wanted to look at what about people who had looked different before the disaster hit. This is showing for people who had poor, fair, and good credit before the disaster hit. So the yellow line is poor, people with poor credit before the disaster hit, fair, and then good credit is the lighter blue line. We see more substantial differences in the three groups for those hit by medium-sized disasters. So here, for people with poor credit before the disaster hit, so this is a credit score below 650, they experience the most substantial decline in credit score. So when we look out 4 years after being hit by a medium-sized disaster, the average credit score fell by 29 points for those who initially had poor credit. The credit score fell by 8 points for those who initially had good credit. And we can see in the middle at 17 points for those with fair credit. So there we can see that this larger decline for folks with starting off with poor credit, that we've got this gap opening between and sort of increase in inequality that we can see as a result of the natural disaster. The average credit score in year 4 for people in this poor credit group is 585, so they're already in the subprime range. So this decline of 29 points just pushes them even from poor credit down to very poor credit. And then, as I was mentioning, for people with good credit, it's not as sharp of a decline. When we look at Hurricane Sandy on the left-hand side here, we don't see the same pattern. 4 years after Sandy hit, the average credit score falls by 7 to 8 points for those with initially poor credit as well as those for initially fair and good credit. So it's pretty similar. But I want to point out that this pattern showing this larger decline for medium-sized disasters versus Hurricane Sandy, even for these similar populations, those with poor credit, is consistent with our hypothesis that these differences could be resulting from differences in policy responses and resources to the disaster victims after these medium-sized versus larger disasters. One final point here, so this looks at differences by credit score before the disaster hit. We also look, for example, at communities of color versus communities that are majority white, and we see larger declines in credit scores. For communities of color, we see larger declines for communities that are low income. So again, this point about increases in inequality as a result of the disaster. So measures of financial distress. So first, debt and collections. So this is showing debt and collections overall and utility debt and collections. So debt and collections, this is debt that is so severely delinquent that it's in this collection status. And having debt and collections is suggestive that people are not able to meet their financial obligations. What we're finding, you can see these green circles, the share of people with any debt and collection is 5 percentage points higher after the first year after the disaster, and this rises to 10 percentage points by the end of year 4. So this is increased above and beyond what it would be without the disaster. So really substantial, 10 percentage point increase in the share of people with debt and collections on their credit report. When we look at utility debt and collections, it starts out at a lower increase after 1 year, 2 percentage points higher, but the effect rises to 10 percentage points after 4 years. And this really is an indicator. The fact when people can't pay their utility bills, it's really an indicator of financial distress. The average amount of increases in debt and collections, so the average amount of debt and collections is higher by about $2,000 after 4 years. This is total debt and collections. This is about 75% higher than the comparison group. And then we see for utility debt and collections, it's higher by about $160 after 4 years, or at 4 years. Another measure of financial distress is bankruptcy. So this is measuring, was there a bankruptcy in the past 2 years? And what we see is that the share of people with a recent bankruptcy declaration is higher by about 1 percentage point in each of the post-disaster years. And while you might think this is small, and it's small in absolute terms, the overall rate of bankruptcy in the comparison group is about 1%. So this means that the disaster is basically doubling the rate of people declaring bankruptcy, so very high in relative terms. So credit card access and debt. Credit cards can serve as an important source of liquidity for people after a natural disaster, but accumulating credit card debt can be reflective of financial challenges. We look at whether or not people have a credit card, which we interpret as telling us something about people's access to credit, and then the amount of credit card debt, which we interpret as a gap between their resources and their needs. So first, what we're seeing is credit card access declines for struggling residents and debt increases for better off residents. So here we're looking at the difference again for people with poor, fair, and good credit before the disaster hits. And what we see is that for those with poor credit before the disaster hit, the likelihood of having a credit card falls by 4 percentage points after 1 year, but increases to 8.6 percentage points after 4 years. So you can see that circled there, the yellow line. So this we interpret as decline in access to credit, which is consistent with what we saw over time with the declines in credit scores. I should mention, I don't think I said this is medium-sized disasters. For those with good credit before the disaster hit, the likelihood of having a credit card rises a bit by 4 percentage points after 4 years. When we look at the amount of credit card debt, we see that for those with poor credit before the disaster, the amount of credit card debt declines a bit over time, and by the 4th year after the disaster, it's lower by $263. But I do want to point out here that this doesn't mean that these people are better off, that we don't see, for example, alternative credit that they might have taken out. So payday loans, auto title loans. So this is a decline in credit card debt. It's not necessarily a decline in debt overall. In contrast, we see those with good credit before the disaster, the amount of credit card debt they carry is higher by about $900 in the first 2 years after the disaster, and by about $700 in year 3 and 4. You can see that circled there at the last point there. And then just one slide on mortgage delinquency and foreclosure, home foreclosures. We're seeing larger effects here for Sandy than we are for medium-sized disasters. So for those affected by Hurricane Sandy, we see sustained increases in mortgage delinquency, and these effects are relatively large. So this is on the left-hand side. In years 2 through 4, the mortgage delinquency rate is higher by roughly 1 percentage point, and this is large relative to the average of 2 to 3 percentage points. So it's a big increase in relative terms. For medium-sized disasters, we see some increases in delinquency in years 1 and 2 by about 0.5 percentage point, but that fades over time. For foreclosures on the right-hand side, for Hurricane Sandy, we see that increases in foreclosure, but it emerges with a slight lag. It becomes positive and significant in year 2. So this is consistent with the negative effect of natural disasters taking time to lead to a foreclosure. We do not see any effects on foreclosures in the medium-sized disasters. I want to make the point here that because the foreclosure process is determined by state policies, you can really see differences across states, and I think that there is more that could be uncovered with this. That part of this could be the state, and part of it could be the size. So just the major takeaways here. Disasters lead to broad and often substantial negative impacts on financial health. Negative effects, they persist and even grow over time for some of our outcomes. The medium-sized disasters appear to lead to larger and more consistently negative effects than these larger disasters. Again, just the caveat there that a lot of these people were hit by storm in and around Detroit, and that individuals and communities more likely to be struggling pre-disaster are often hit hardest again, and this can increase inequality. So I'm going to turn it over to Carlos.
All right. Thank you so much, Caroline. And thank you also to you and your entire research team for this tremendous analysis. I think as a resident disaster researcher at Urban, I can't stress enough how important these findings are for a variety of reasons. For starters, no one has looked at financial outcomes at this level of granularity and with this richness of data, so that a contribution is significant. Second, no one has looked across disasters. Typically, disaster researchers, especially the few that look at finances, focus only on large-scale disasters. And these disasters tend to be the ones that receive massive amounts of public assistance, charitable aid, and private debt relief. So, most importantly, this research fills the gap among policy analysts who have relied on anecdotes about whether and when assistance is needed. As disasters of all kinds of severity become more frequent and our vulnerable populations grow, rethinking the public disaster safety net is urgent, and this work contributes to that. So let me talk a little bit about that public safety net. The federal government, in coordination with state and local governments, provides a variety of disaster recovery and relief policies and programs. Key among these are FEMA's Individual Assistance Program and the Small Business Administration's loans for homeowners. The timing of applications and duration of assistance for programs are shown on this slide that you see. So both of those are short-term. Congress can appropriate funds to HUD for the Community Development Block Grant Disaster Recovery Program. HUD grants state and local governments these funds to fulfill unmet housing needs. But again, CDBG-DR is currently only available after special congressional appropriation, which usually follows only the most severe disasters. And even then, as recent events have shown, that does not also always occur. Ultimately, these programs help. They pay for a few vital services immediately following a disaster. They help with some lower income households navigate through tough economic circumstances. And they provide some relief for households to rebuild or recoup some of the economic losses caused by the disaster. Yet, even then, when these programs are available, when the long-term funding is available from HUD, there is still this valley of death that occurs for individual households in between the short-term relief that they receive and potential longer-term. And again, the majority of times, the longer-term does not come in to help fulfill these gaps. So what does this study findings mean for public disaster policy? We suggest 7 key implications, starting from the more general to the more specific. First, post-disaster programs and resources should strive to go past the short-term relief and response mentality and consider long-term needs. We find that the negative effects of disasters persist and even grow over time. Current assistance is insufficient and insufficiently timed. Extending periods of assistance could help, as would relaxing or extending application deadlines. Second, a larger share of disaster resources should be aimed before disasters hit. I have said before, and I will say it again, we spend 1/16 on disaster mitigation before a disaster as the amount we spend on recovery after. I'll repeat, 1/16. Even within that fraction, though, there are no financial mitigation activities. Financial mitigation in the form of disaster savings, literal rainy day accounts, and appropriate insurance should be encouraged, especially in low-income communities that are often the hardest hit by disasters. Third, we should expand the post-disaster resources available to communities and people hit by less severe disasters. As currently designed, there is significantly less disaster relief provided to residents hit by these lesser severe, the medium-sized disasters that Caroline was mentioning, than those hit by the large disasters. Stability and consistency, accompanied by clear and transparent triggers for aid launch and program eligibility requirements across the various aid programs, can minimize confusion among local providers and households, as well as reduce redundancies that may make precious disaster funds go further. Fourth, state and local resilience and disaster plans should incorporate financial health. The traditional model of disaster management focuses first on relief and response, followed by property rebuilding. At a basic level, local leaders should think about how to integrate financial health into existing recovery platforms as much as property rebuilding. A corollary to this suggestion is the expansion of conduits for informing affected households of their options and aid eligibility. For example, through private lenders or creditors and through credit reporting agencies. These organizations are financial first responders for households and should be tapped as communications channels. In addition, we have identified 3 strategies that link to specific findings. Fifth, we consider rules and guidance around how natural disasters and subsequent delinquencies are identified on consumer credit reports and incorporated into credit scores. A recently released Consumer Financial Protection Bureau report shows that a natural disaster indicator stays on a consumer's credit report for an average of only 2 months. Our findings suggest that 2 months is not long enough and that consumers could benefit from having these indicators on the report for well over a year. Sixth, state and municipalities should take steps to provide consumers with utility-related protections after disaster hits. States could require both publicly owned and state-regulated private utilities to better address consumer needs after disasters. States are aware that federal low-income home energy assistance programs, LIHEAP funds, can be used flexibly after disaster, but additional federal funds are needed to actually address those concerns in those households. Finally, rules to mitigate against mortgage delinquency and foreclosure should account for long-term financial burdens following disasters. After Hurricane Sandy, the lack of an impact in the first year is consistent with the idea that current programs such as foreclosure moratoria, forbearance plans, and loan modifications are working in the short term. Yet mortgage delinquency and foreclosure increase significantly in the second, third, and fourth years following a disaster among people with a credit report. Homeowners affected by disasters may need assistance for many years. One option is better assistance in navigating the disaster aid application process, especially if their homes are underinsured. So who should take these recommendations to heart? Much of the work associated with operationalizing these recommendations lies in the hands of Congress and federal program administrators. However, state and local entities can independently reduce silos between economic development, long-term planning, and financial safety net activities that they conduct. Private sector lenders, creditors, banks, and affiliated financial institutions such as mortgage underwriters and credit reporting agencies also have a role in providing information to public officials for planning and response functions. I should note that the financial assistance field experts and direct service providers that we spoke to as part of this work underline strategies aimed at ensuring vulnerable individuals and communities are not left behind. So I want to pass the mic over to one of those direct service providers, and this is Zelalem de Vries at Catalyst Miami. I'm happy to pass the mic to you now, Zelalem.
Thank you so much. This research is really, really great. So I'm so happy that it's out there and it's done, and hopefully will lead to some policy change. I'm Zelalem de Vries. I'm the Resilience Director at Catalyst Miami. We are a local anti-poverty nonprofit based in Miami-Dade County. We do direct services, so financial coaching and health coaching. We do policy and advocacy work. And community leadership and empowerment trainings. And then lastly, we do network building and coalition building throughout South Florida. Can I get the next slide? Great. So I wanted to talk to you all about Hurricane Irma in particular, which hit us a couple of years ago now. Hurricane Irma was a Category 1 hurricane, but it had tremendous impacts on Miami-Dade County. And I think when I talk about climate change to audiences, it's a perfect example of why an anti-poverty organization like ourselves gets involved in climate change work and hurricane relief work and advocacy. Can we go back to the previous slide? Okay, well, on the previous slide, I wanted to, yeah, okay, perfect. So in Miami-Dade County, about 60% of our households are in poverty or the working poor. If we kind of extrapolate that out to the number of people, it's about 1.5 million people in our county. And Hurricane Irma was a perfect way to highlight this. So this image is of Tropical Park, the first Saturday that they released disaster food stamps. Disaster food stamps are food stamps that are not typically available to those. Basically, there are wider qualifications than those that would typically qualify for food stamps. And so on that Saturday, there were 50,000 people that lined up to receive this disaster food stamps. This was a huge amount of people. They waited in the hot sun for hours and hours. The government was not prepared. They served the first 10,000 people and then sent everyone away, given the huge volume of need. And again, this was a Category 1 hurricane. So I want to go to the next slide and give you guys some examples of why, why there's such a huge need and the specific challenges presented by Hurricane Irma. And I think the way I'm going to do this is by presenting you with some anecdotes about what these things look like on the ground. So the very first point I wanted to talk about was the high cost of hurricane preparedness. Personally, I've lived throughout the country and been a part of many natural disasters, unfortunately, but hurricanes by far, in my experience, are just extremely expensive. And this is really difficult when you have 60% of your population in the considered working poor and poverty, given that hurricanes, they're not easily predictable. And so you have to make the choice, and often a lot of our clients make the choice between food stamps, or not food stamps, sorry, buying food or also stocking up on water, given the lack of predictability for the hurricane. We also have price gouging, which is a huge issue, both after the storm, when doing repairs, lifting trees off cars and off homes, but also when you're if you are able to evacuate and trying to leave with gas, with the cost of water, with just about everything, it will go up astronomically. Although price gouging is illegal, it's all on the authorities to kind of stop this and on the public to report where they see these things. A lot of community members that we worked with when we did relief for hurricane had lost food. They cited that as one of the biggest impacts of the storm. Our power went out across the county for up to 10 days for many, including myself. And so when your fridge is off for up to 10 days and it was extremely hot and humid after Hurricane Irma, most people lost their food that they had stocked up on for the weeks and coming month. One of the most kind of shocking and unfortunate things that I personally saw were widespread evictions. The hurricane and damage, which I'm using air quotes, you can't see, but that was used as an excuse by many landlords to evict their tenants. We had tenants in rental buildings sleeping outside in the parking lot because they were told there was damage and they cannot return to their apartments to gather their belongings. And so as advocates, something that we're looking into and hoping to pursue is a moratorium on evictions post-hurricane for a certain amount of time, given that the building is declared safe. We are a tourist economy, so tourism was definitely down after Hurricane Irma. A lot of restaurants, hotels were closed, some shut down for good, and so we saw a lot of our clients lose their jobs or had a stall in work until those businesses could get back on their feet. And this has huge impacts with the inability to keep up with bills, your rent and utilities. And then the lack of savings for most of our population made it hard for people to pay their deductible for their homeowners insurance so that they could even get the repairs on their property done. And then lastly, one of the biggest challenges on the relief side, we were working to assist people filling out their FEMA assistance forms was number one, the proper filing of the form, being able to check the status online. A lot of people that we work with don't have consistent access to the internet. And then if you are undocumented, but you have children that are US citizens, they are able to claim FEMA assistance. However, we had challenges with their social security numbers and, of course, the comfort level of people being able to know that at least their kids are able to get these to the FEMA assistance. Can I go to the next slide? All right, so that's a whole host of challenges, and I didn't go into mental health and the stress and the physical stress that comes with preparing and cleaning up after a hurricane. But I did want to talk about what we are doing as Catalyst Miami to build resilience going forward. Like I said, we were doing relief work immediately after the storm and for several months that followed. This included dissemination of emergency loan programs, coordinating with law clinics, the FEMA form assistance, and then the distribution of basic supplies such as water and food. And we plan to do this, continue to do this in the future, when the next storms roll around, which is hopefully not soon. We are incorporating resilience into our ongoing financial coaching programs. We are about to launch an emergency savings match program. Around tax season, we generally do a savings program to get people to save their tax returns. Usually our end post is towards the end of the year, towards the holidays. We're shifting that up to encourage people to save as much as they can for the hurricane season, and then if we pass, they have that money for the end of the year if we pass without a storm. And we are launching a match program actually this year so that people can save a certain amount, and then we'll match the other amount for hurricane season, which starts on June 1st. And then lastly, we have two offices, one in City of Miami, and then which is an urban area, and then one in a more rural area in Homestead, Florida. And we are working to actually decentralize our organization to the neighborhood level. We are working with our county to move Catalyst into 5 county buildings and operate all of our services, including the financial services, health services, policy and advocacy work, leadership trainings, and the network building work, so that these sites become a place that hopefully makes sense for community members to go to during and after before and after a storm to get assistance. There was a lot of confusion during Irma about where exactly to go, where to get help. It had been a long time since Miami-Dade County had a significant storm. So it just wasn't in the memory of most folks, I think including our services organizations as well as the local government. So we're hoping that as we continue to offer services year-round at the neighborhood level, and of course we have the commitment to do hurricane relief at the neighborhood level, we'll be able to alleviate some of that confusion. And then of course, as Carlos presented earlier, we'll be providing our financial coaching there and these savings programs, and hopefully we'll be able to alleviate some of the lack of preparedness in our communities. So that's what I wanted to share about Irma. I know that we're going to open up to Q&A, so I'm happy to take any questions.
That's great. Thank you so much. So again, if you have questions, we've got some questions in, but if you have additional questions, just type your question into the comment box, and it'd be great to include your name and organization. So first question for you, Zelalem. How does Catalyst Miami, how do you coordinate with local government officials and other stakeholders in your work around disaster preparedness and the aftermath?
Yeah, so like I said, we work in networks and coalitions, one of which is the Miami Climate Alliance. That's an 80 organization network working on climate change issues. As you may know, Miami-Dade County is considered ground zero in the U.S. for climate impacts. And so during, as the hurricane was impending and in the days afterwards, we worked together to come up with these community emergency operations centers, which we're now calling resilience hubs. And so we helped basically pop up relief centers in the neighborhoods and do the work that I stated earlier. With the government, I think we all realized there was a lot of work to do after Hurricane Irma in particular. It just had been a long time since we had a disaster. And so now they're doing a lot of work, bringing community organizations to the table and talking about preparedness and relief going forward. So we're in attendance at those meetings and trying to figure out how to coordinate. I think this collaboration using the county, it's their human services buildings to do our work out of will be like a good collaboration to see how we can better work with the community. However, government, it is bureaucratic and there's lots of departments, so we're still working to bridge human services with emergency management and having all these separate conversations and bringing everyone to the same place.
Thank you so much, Zelalem. And I would like to say that in some of the interviews we did for this study, we also noted other local service providers, including nonprofit financial service providers, that said that there was the same sort of set of networks that were occurring immediately after the disaster, in which referrals were occurring between city and county agencies, as well as the service providers referring across themselves. And so those networks are obviously very critical. So we already have another slew of questions that are coming in. Let me ask the first one that I have on this list. Are you aware of any research that explored the impact to state and local government budgets, cost of services related to financial impacts you uncovered in this body of research? So again, the study was focused primarily on household level financial impacts and not on state and local government impacts. I am familiar with some of the work that the National Association of State Budget Officers has been doing. The challenge in so many of these studies is looking across all of the state or local agencies that may have some kind of assistance or some impact to their budgets that occurs afterwards. So the literature is somewhat limited, just as limited on the household side. But if anybody would like to follow up on additional literature questions, we'd be happy to answer those offline. A second question that's come in as FEMA's temporary disaster housing program assistance was not on the list, question mark. It actually was. So IA, the individual assistance program at FEMA, includes individual and household programs in which temporary shelter, as well as other housing related programs are included. So on the slide, and I'm not sure if it's worth it to go back to the slide, but I could show it quickly. You will see the temporary housing program in tiny font. You'll see the second one in blue. After state mass care and emergency assistance is the FEMA transitional shelter assistance. So again, I'd refer you to the report where you could see more description about each of these programs as well.
Okay, we also have a question about increased incidence of financial fraud affecting individuals after disaster. I think part of this, in terms of quantitative research, we haven't. Certainly in some of the background interviews that we did with folks, and then I'll give Zelalem a chance if she wants to talk more about this, but that in terms of people, fraud around housing repairs, and that there was lots of opportunities and people needed to be very aware, and that some of the localities were putting out information on how to identify a reputable contractor, thank you. And also steps for contractors and what they needed to do in order to be identified as a reputable contractor. So in these ways, I think that there are ways in which localities can really get out in front of this before the disaster hits and have materials ready for folks both on the contracting side and also on the resident side. Salam, do you want to add?
I'm not sure I have any anecdotes to add about reputable contractors, but I just do know that the cost of contracting services really skyrockets. Like personally, in my apartment building, I had leaks for like 7-8 months because my condo association couldn't afford the cost of the repairs. I have a very small building. And then we actually had a community member start, there were so many people that couldn't afford to do their repairs that we had a community member start a project that we assisted him with, which was called Conscious Contractors. They actually are a group of community members that did free repairs, mostly tree removal on cars and homes. And they went out every day and worked, I think they worked for a full year after Irma all across the county, helping the elderly and low-income and working-class folks be able to make these repairs. Because of course, if there's a tree on top of your car, you can't get to work. It really spirals the debt that you showed in your previous slides and in the studies.
Great. And I know you mentioned in your presentation some of the rental gouging that was occurring that has typically occurred across most disasters. So since we still have you on the line, Zelalem, I'm going to give you the final question that we have. And this, if I can report the person who's reporting it, I'm Kate Bolger with Money Management International. My question is for Ms. Adefris. It sounds like you're doing amazing work, she says, exclamation point. If there's just one thing we can do to move the needle to improve long-term disaster recovery for low to moderate income at-risk populations, what would be most impactful in your experience?
That's a really good question. I do think, there are 3 days, the government says you should prepare to be on your own 3 days before a storm. And that can be really, really hard for people. And, the government says that because it's really hard to activate immediately after a storm because your staff, everyone has their own families and we're kind of in it together. So, I would say from what I've seen, I think like really investing, not only in government efforts, but in community kind of grassroots efforts has been extremely impactful. Again, like the example of Conscious Contractors and some of the work that our colleagues and the other local financial institutions have done can really help bridge that 3-day gap and also build resilience on the preparedness side, which is so often overlooked across the year. So like Carlos said, and I think there's a saying like an ounce of preparedness is worth a ton of response, at least in dollars. So that's where I would suggest.
Right.
Great. So thank you so much. Thank you for everyone for tuning in. We're at just at 1 o'clock. So just want to thank Anne and Zelalem, Carlos, and then the rest of the research team here. And you will be getting an email with the slides and the recording. So thanks, everyone.